I'm Dr. Teresa Dean.
And I'm Dr. Bojana Jankovic.
And today we're going to talk about men's health. So the head of the International Society of Men's Health actually indicates that at least 40% of men at age 40 have not had their cholesterol checked. And a third of them are not going to annual physicals.
And that's really astounding data, especially considering that half of our population is overweight and 1/3 obese. And these are concerning risk factors for development of chronic disease, including diabetes, high blood pressure, high cholesterol, heart disease, cancer, and the list goes on.
Yes.
And so what can we do about this? Well, it's really important to get our screening when we should. So the American Heart Association recommends that blood pressure should be screened for hypertension or high blood pressure every 2 years after the age of 20.
And really you want to think about what's normal for you. So, blood pressures that are under 140 and systolic is really a big thing that we focus on. After that, you may need to increase the frequency with which you're seeing your physician if you're seeing numbers over that.
Absolutely. So anything greater than 140/90 for the general adult population. And of course, if you do have other chronic conditions, you might have a different goal for yourself.
Absolutely. And the National Cholesterol Education Program recommends that men over the age of 20 have their cholesterol screened every 5 years, as long as it looks good, and over the age of 40 are screening every 3 years, as long as it looks good, which we don't see that often.
That's so true, absolutely.
Yeah.
And the American Diabetes Association recommends that we should be screened for diabetes every 3 years, especially those who are at high risk of diabetes. And that would include a multitude of factors, including family history of diabetes, high cholesterol, high blood pressure, obesity, and so on. So definitely discuss with your doctor whether you might be at high risk of developing diabetes. Other screening tests that are really important, STD or sexually transmitted infections, STIs are really important. Alcohol and smoking use, cessation, and so on should be discussed with your doctor as well. And overall, it's really important to discuss healthy habits with your physician. So what are your general lifestyle habits, your sleep, your exercise, your nutrition, all really, really important things to talk to your doctor about when it comes to preventing, reversing, or managing your chronic disease.
Absolutely. And another big topic in men's health is talking about prostate cancer screening. The American Urologic Association is recommending that men between the ages of 40 and 54 that are higher risk, such as having a positive family history or black men, should be screened with the PSA or at least have a conversation about it starting at the age of 40.
And for men with an average risk, between the ages of 55 and 69 is really when that conversation should take place. Of course, it doesn't hurt to have that conversation earlier with your doctor and talk about risks versus benefits of screening. But again, according to the American Urologic Association, between the ages of 55 and 69 is when men of average risk should have that conversation about PSA screening.
Absolutely. And then the other thing is, when do we stop having that conversation? And there have been some kind of arbitrary numbers put out there over the years, 70 or 75, but most organizations agree that we're really looking kind of in a backward sense, is that we should stop when our life expectancy is around 10 to 15 years. Now, that's not an easy thing to predict, but in general, the overall sense is that if we think there's some other major life-limiting illness out there, that it wouldn't be a great idea to go chasing after a PSA, because it tends to be a more slow-growing cancer, and most men may pass with that if there's something else going on, rather than that being a cause of death. So that's the reason. It's not that your physician's giving up on you or that healthcare is giving up on you. It's that we may put you through more things that would cause you problems when it wouldn't actually be something that's going to impact your health. So our overall message is, please get to the doctor. This data reflecting that men aren't getting in to see the physician is really concerning, and we need you guys around.
Thank you for watching.
Thank you.